Okay. My name is Seiko KOU, and I am a plastic surgeon and a cosmetic dermatologist in Japan. Today, I would like to thank the authorized member of BIOR for giving me such a valuable opportunity. I would like to talk about introducing the roles of SYLFIRM for melasma on Asian skin. I have practiced aesthetic dermatology while valuing the diagnosis by using BZI evolution since 2008, investigating the best possible balance between melasma treatment and skin rejuvenation by combining simple skincare treatment and devices. I would like to talk about why SYLFIRM is necessary for this cosmetic dermatology, including the history and problems of energy devices. My treatment purpose is to beautify all layers of skin. Therefore, the patient's treatment menu is selected by the doctor under diagnostic imaging. We call it customized treatment. Let me talk about the long-term process and the transition of devices. This is one of our staff members. It's been about 12 years since I started working on her. I have treated her with various beauty devices such as laser, phototherapy, high frequency, and HIFE. I will introduce the progress of our treatment with the history of device development. There are devices for each layer of skin. I will present the devices which I use since I started the cosmetic dermatology treatment 12 years ago. First, I began using long pulse Nd:YAG laser for hair removal and improving skin quality, which called Genesis. At the same time, I started IPL treatment. Then, I began RF treatment and started laser toning treatment with nanosecond Nd:YAG laser around 2010. After that, I began using non-ablative fractional laser and started HIFE treatment in the subcutaneous area. And from around 2017, I started picosecond laser treatment. I'm currently using 4 picosecond laser, first with Nd:YAG Pico, and from 2019, I started using alexandrite Pico recently. We are also using multi-pulse needle RF, which reconstructs the basement membrane. It was a time when I was mainly using IPL. Pigment spots remain. Laser toning with nanosecond Nd:YAG laser makes the pigmented spots much lighter, and the rejuvenation effect is even better. From here, it is time when HIFE and infusion treatment were improving the sagging. From 2017 to 2020, picosecond laser further improved the texture, the pores, and the wrinkles. Multi-needle RF also improved epidermis function and dermis rejuvenation. The target of my treatment is all layers of the skin. I call it customized treatment. The treatment is once a month and continuing for 6 months. We aim to complete 70% of the target in 6 months. At our clinic, many people have solar lentigo and melasma, so the main treatment is the epidermis at starting. After beautify the epidermis, I often use needle RF or Nd:YAG Pico MLA treatment. It has an excellent remodeling effect on the dermis. After 6 months, all layers of the skin will be better about 70%, and maintenance treatment will be performed once every 2 or 3 months. Almost all cases have conservative treatment, which consists of oral tranexamic acid and topical whitening cream, and we provide guidance such as gentle skin care and UV care. These treatments are called conservative treatment. It is very important for controlling activity of melanocytes. It will be a comparison of the frequency of use for each device at my facility. Alexandrite pico laser and ruby fractional laser are frequently used, and it can be seen that they are very useful for solar lentigo or melanin disease. Long pulse LED YAG laser are most common device because in my clinic, hair removing and adapted for all cases. Multi-pulse needle RF treatment is increasing recently. It is a device that can promote the rejuvenation of the dermis, while it improves the function of melanocytes. This is a monthly change in the frequency of use of the multi-pulse needle RF. It also shows the breakdown of SYLFIRM and potenza. Since September of last year, more than 100 cases are performed, and the number is still increasing. When considering the role of SYLFIRM in the treatment of skin rejuvenation, there are 3 roles. First, for solar lentigo or melasma, mixed pigmentation, which are difficult to improve, SYLFIRM assists to improve the environment of increased melanogenesis. Second, recovery of iatrogenic depigmentation and improving pigmentation. Third, improvement in pigmentation and rejuvenation at the same time. It is a case some pigmented spots improved by laser treatment, but only the melasma remain, and it is difficult to improve. Melasma improved by SYLFIRM treatment 5 times. This is a case where pigmentation and laser-induced PIH are mixed and difficult to improve. Laser treatment with SYLFIRM was performed 4 times for a year. The intractable pigment spots are improved and the rejuvenation effect is also good. This is a case where pigmentation and laser-induced PIH are mixed and difficult to improve. Laser treatment with SYLFIRM was performed 4 times for a year. The intractable pigment spots are improved and the rejuvenation effect is also good. Let's think about the difficulties in treating Asian skin and how to troubleshoot them. At first, what is the problems in the laser treatment of mixed pigmented region, especially melasma and solar lentigo? This is a case of both solar lentigo and pigmentation like melasma. We performed several laser treatments, which performed every month 4 times. Some pigment spots and pigmentation were getting worse. Why? After that, the patient started taking tranexamic acid daily. The pigment spots and pigmentation was getting better. In this case as well, tranexamic acid has begun to be taken orally, and the pigmentation have improved. Pigmentation like melasma and pigmented spots are mixed. tranexamic acid blocks the action of plasmin, thereby suppressing the production of melanocyte-stimulating factor, which activate by plasmin. Solar lentigo and melasma often coexist, and it is necessary to consider control of melasma at the same time as treatment of solar lentigo. As in the previous case, when tranexamic acid couldn't be taken orally and the melanocytes were stimulated, even if the pigmented spots are destroyed by laser treatment, melanin granules are produced from melanocytes and the state of pH continues. This situation is difficult to treat. We should control the activity of melanocytes. This is a pathological mechanism of melasma. How to control the activity of melanocytes is the key. Managing external stimulation, such as UVB and physical stimulus, is the top priority. Hormones are difficult to control. Tranexamic acid blocks several melanocyte stimulants. Antiplasmin is very effective for suppression of stimulants. This is an essential treatment for conservative treatment. After that, when you could see the activity of melanocytes becoming stable by observing the improvement of pigmentation with a diagnostic imaging. Treatment using devices will become effective. As mentioned above, it is important to determine the degree of AMC by diagnostic imaging and select a treatment method that can achieve both spot treatment and dermis rejuvenation treatment while controlling AMC. This is called customized treatment. About customized treatment, to treat all layers of skin at our clinic. In order to stabilize the activity of melanocytes, it is essential to have a skin care instruction, internal use, and topical approach to UV care, such as slides. Under the condition that AMC continues to be stable, we will appropriate select the treatment of devices. I think it's important to diagnose the activity of melanocytes. The activity of melanocyte is expressed in color. If it gets worse due to the treatment 1 month ago, it will be red. If there is no change, it will be yellow. If it is light and stable, it will be blue. This is a case that melasma was worsened with nanosecond NdF laser toning in the early days. At this time, laser toning stimulated melanocytes to increase their activity and that increased pigmentation. Therefore, I switched to just a conservative treatment and her melasma improved. Through checking the process of pigmentation by diagnostic imaging, we could confirm that the activity of melanocytes had stabilized. As we conducted nanosecond NdF laser toning, the melasma got better. And at that stage, I changed to picosecond NdF laser toning, which further improved the condition. When deciding on a treatment policy based on the activity of melanocytes, we consider the following. The vertical axis is the axis that protects the function of melanocytes. And the horizontal axis is the axis that destroys melanin granules of keratinocytes. It is a schema that ranks the devices of my clinic. This schema is for previous case. The condition got worse with nanosecond YAG toning, So I switched to just a conservative treatment. And after that, the pigmentation improved. So I applied nanosecond YAG toning again. And this time, the condition got better. Then I used picosecond YAG toning to improve it further. If the activity of melanocytes in melasma and pigmentation are moderate, Pico 755 or Ruby fractional can be used to improve pigmentation and dermal rejuvenation at the same time without worsening melasma and pigmentation. Pico 755 and Ruby fractional are positioned in the customized treatment table. They can stimulate melanocytes more gently than other devices, while the treatment effect of these devices on melanin pigment is also effective. Multipulse needle RF situate near the conservative treatment. It is essential to diagnose the activity of melanocytes by diagnostic imaging, and we should select appropriate treatment not to stimulate melanocytes. Conservative treatment is necessary to control the activity of melanocytes. In particular, oral tranexamic acid is very useful for calming the activity of melanocytes quickly. Next problem, when performing device treatment for photoaging skin and melasma, we should choose the treatment that suits the condition. Otherwise, patients will have complications that are difficult to recover. Many changes in the dermis have been reported for melasma. Actinic elastosis characterized by destruction of the basement membrane. In other words, it can be said that not only the problem of the epidermis, but also the reconstruction of the dermis is necessary as part of the treatment of melasma. How about laser-induced basement membrane alternations? From around 2009, a treatment called laser toning with a nanosecond ND-YAG laser has spread worldwide. A few years later, laser treatment caused iatrogenic damage to the basement membrane, causing pigmentation and depigmentation. This is a case of my facility in 2010. After treating melasma 21 times at short intervals every 2 weeks, we noticed loss and stopped treatment, but didn't recover even after 8 months. A UV image of Vizia showed slight sign of depigmentation in the second month. If I noticed it early and stopped it, I might have been recovered. In such a situation, in 2018, there are interesting reports from Korea. Improvement of melasma is achieved by special needle RF, which eliminates pathological capillary, decrease of aging fibroblasts in melasma area after the treatment are observed by immunohistochemical analysis. It makes the dermis healthy and beautiful. Soon, I was lucky to have a chance for using multipulse needle RF, which I hope it as a saver of difficult cases to improve. The device is called SYLFIRM. Multipulse needle RF selectively destroys pathological blood vessels and basement membrane of the papillary dermis and reconstruct the basement membrane. Experiments with nude mice have reported pathological vascular collapse, and in a nude mouse experiment, a thick basement membrane was reconstructed 14 days after irradiation of SYLFIRM. Whether it was refractory melasma or iatrogenic depigmentation, I then felt that this multipulse needle RF would be the saver. After about 2 years of verification, my hope changed to confidence and conviction. Troubleshooting, check for depigmentation as soon as possible with an ultraviolet image. For recovering the damaged dermis, it is important not to irradiate the laser unnecessarily. Elimination of the dermis is important for improving the pathology of melasma. The multipulse needle RF has the potential to be positively recovered then. About the clinical practice, I will talk about the experience of 300 cases for 2 years. Most cases basically practice conservative treatment, including topical tranexamic acid. The protocol recommended by the manufacturer is here. In our protocol, the fluence level is set to level 3, and the needle length is set to 0.3 millimeter for melasma and PIH that require basement membrane construction. About cases of melasma in a broad sense in which melasma or laser-induced PIH and pigmented spots are mixed. Laser treatment was performed 5 times a month, but AMC was slightly increased. PIH and pigmented spots remained mixed. Then, SYLFIRM treatment was added to it 4 times in about a year. They significantly improved. Melasma has been difficult to improve for a long time, and then the addition of SYLFIRM 5 times for 8 months improved severe melasma. Depigmentation has also been improved. This is a case of unstable melasma, which was worsened by retinol. Then the treatment was changed to multipulse needle RF, and melasma became stable and improved. The melasma mixed with pigmented spots were difficult to improve for a long period. Then the addition of SYLFIRM improved them. Melasma in a broad sense, short-term cases. Immediately after the second treatment was switched to SYLFIRM, and pigmentation like melasma improved early. If the solar lentigo is removed and the pigmentation becomes the main problem, treatment will be recommended changed to SYLFIRM at an early stage. Then the pigmentation will be easier to improve. melasma in a narrow sense. This is a case in which refractory melasma was improved by SYLFIRM. This is a previous case in which pigmented spots were removed to some extent by laser treatment, but melasma wasn't and recovered by SYLFIRM. Based on medication of tranexamic acid and gentle skin care, SYLFIRM improved severe melasma. SYLFIRM doesn't improve all melasma, and in some cases it wasn't, in which case it should be changed to just only conservative treatment. The case of depigmentation. This case is an iatrogenic case. I continued to irradiate the pico laser for a long time despite occurrence of depigmentation in early days. Eventually, this SYLFIRM treatment recovery depigmentations. While 14 months from the first visit, there was clear depigmentation on the UV image. And without noticing it, we continued to irradiate the pico laser 5 times for about 10 months. From there, I recovered the depigmentations with SYLFIRM. Before SYLFIRM and after. UV image depigmentations were recovered to some extent. Mixed case of pigmentation and depigmentation with severe AMC photoaging. This is a case who has been working in the field for a long time and has remarkable photoaging, and solar lentigo and depigmentations coexisted. Laser treatment improved some pigmented spots, but severe pigmentation and iatrogenic depigmentation were remained. Therefore, the treatment has been changed to SYLFIRM. Then, about 1 year later, all layers skin, including epidermis, has become healthy and uniform. Laser treatment improved some pigmented spots, but severe pigmentation and iatrogenic depigmentation were remained. Therefore, the treatment has been changed to SYLFIRM. Then, about 1 year later, all layers skin, including epidermis, has become healthy and uniform. Similarly, it is a case of severe photoaging resulting in laser-induced iatrogenic depigmentation and pigmentation. About 1 year later, all layers skin, including epidermis, has become healthy and uniform. UV image, some depigmentations improved. Summary. SYLFIRM stabilized AMC by removing pathological capillaries in the upper layer of the dermis and reconstructing the basement membrane in cases with high AMC, melasma or PIH. As a result, even in cases where melasma and pigmented spots are combined by using combination with a later. Epidermis will be improved while suppressing complications of PIH or depigmentation. It can be expected to have effect for pigmentation and depigmentation in photoaging skin or iatrogenic trouble by laser irradiation. Normalizing melanocyte activity by remodeling the basement membrane and treating pathological blood vessels. This is the end of the presentation, but I am sorry, this is a private announcement. I would like to share my knowledge and experience with medical professionals, not only in Japan, but also in the world, at the Customized Treatment Study Group. It's a Japanese site, but we plan to launch it online later this year. Lately, I would like to create site for overseas. Thank you for your attention. Thank you.
Thank you, Dr. Ko, for your excellent presentation. We are now going to begin answering the questions submitted during the presentation.
Yes.
As a reminder, you can still submit questions through the Q&A icon in your control panel.
Okay.
Our first question is, how do you adjust parameters? For instance, needle depth according to skin thickness and treatment site?
Parameter. Okay. In my experience, a needle depth of 0.3 millimeter is effective when aiming to reconstruct the basement membrane. About fluence, melasma is nervous to irritation. So as I mentioned in the presentation, melasma with high MC is performed at level 3. The standard pulse duration is PW2, but for particularly high MC, it may be set to PW1. Also, when aiming at blood vessels, 0.8 millimeter to 1.5 millimeter is appropriate. The thin skin is 0.8 millimeter and the thick skin is 1.5 millimeter. Fluence is usually done at level 7. For blood vessels with melasma, the pulse duration is set at PW2, and for those with no melasma, only redness such as rosacea, we choose PW3. That's all.
Okay. The next question is, what are the good endpoints right after the SYLFIRM X treatment on melasma? Okay. I think that it will be irritating for melasma if it becomes too red. So I decided to set the number of irradiation passes to 1.5 without setting endpoints such as reaction color. Passes, I think the passes is important, not color endpoint. Okay. Okay. And how many treatments are usually recommended for melasma?
For melasma treatment, it is important that there are many treatment variation, but it is more important to judge the degree of AMC. AMC is activity of melanocytes. I explained in the presentation, and select a treatment method that is suitable to the situation of melasma at that time. As mentioned in the presentation, it is to judge AMC by the change of pigmentation in the reproducible image. For about variation of treatment, the first is conservative treatment. The contents were already shown in the slide. The medication tranexamic acid is most effective. As for external preparations, do you know Cispera is often used recently, especially for melasma with high MC. Recently, I I usually use this speller. I have good results. Based on conservative treatment, if the AMC is little unstable, it will be recommended to SYLFIRM. AMC will be more stable. Toning with Nd:YAG Pico laser and the pigmentation improved moreover. Toning with Alexandrite Pico laser is also suitable. Anyway, it is important to accurately judge AMC by diagnostic imaging and select the appropriate treatment.
Okay.
That's all. Okay.
Okay. And what is the time interval between treatment sessions?
One session every month or 2 months in my clinic.
Okay. And are there any precautions when using SYLFIRM X and laser toning together on the same day?
Yes, I usually treat with SYLFIRM and Pico laser or another laser or devices. In that situation, the SYLFIRM protocol was shown in the slide. At first, laser treatment is performed, and then, after topical anesthesia, about 30 minutes, SYLFIRM is treated.
Okay.
Okay.
And is there any special post-treatment care after melasma treatment with the SYLFIRM X?
Yes. Usually, in my clinic, I use the electroporation is usually added after SYLFIRM. Applications are vitamin C, hyaluronic acid, tranexamic acid, several growth factor, and that's all.
Okay. I think it's time to wrap up. So if you have additional questions or unanswered questions, please contact us at the email address shown in the next slide. Thank you, Dr. KOU, and thank you to the audience for attending today's webinar, and have a great rest of your day.